Jason, we were talking about a little bit earlier. We're wearing pink today. October is Breast Cancer Awareness Month, and we have Dr. Christopher Shale in the house from McKay-D Plastic Surgery with us. We're talking about reconstruction surgery after treatment, doctor.
Thank you.
So glad you're here. This is our Ask the Expert segment, and we want to talk today about the reconstructive surgery. When should a woman consider plastic surgery?
That's a great question. One of the things that's really important is actually before the mastectomy, because a lot of surgery can be done at the same time as the mastectomy. We can start the reconstructive process, sometimes even finish the reconstructive process at the same time as the mastectomy. So if you have that ability before the mastectomy, is a great option. However, there are women who've had mastectomies in the past, didn't know what their options were. It's a very tumultuous time for them. And so even those patients, we're happy to see them as well.
Now, sometimes people realize that they have to have this done quickly.
Correct.
And that's something maybe they haven't given it a lot of consideration. What will they do as far as reconstruction and stuff like that? Can you do it proactively? If someone had a mastectomy years ago or something like that, or retroactively?
Absolutely. Yeah, absolutely. And then we're starting to see that a little bit more now as we're getting better at the reconstructive side. It's becoming more common that women will come back and talk to us later on and say, I wish I'd done this. Is there are there options? And there's always something that we can do. And so that's kind of the important thing, is that if there are a lot of great surgeons here in plastics in Utah, and it'd be a great opportunity to just talk to them if they have any questions.
I know it's a difficult thing for women, and sometimes they feel like some of their womanhood has been taken away. What are some common misconceptions about reconstructive breast surgery?
There's a lot, actually. The first one is not necessarily needing to lose the nipple. A lot of women are very focused on that, because it's a very important part of the breast. So being able to preserve the nipple, or even some of the breast tissue, or some of the skin around, so that you actually can maintain some of the size, that's something that can be done, and people don't realize that. The other thing is being able to use their own body, their own tissue, rather than having to have implants. That's another option.
Amazing things you do. And again, this is our Ask the Expert segment. We've got professionals in the house from Intermountain Healthcare. There they are. They're taking your calls right now. Any health-related questions specifically related to breast cancer, there's the number on the screen. Give them a call. They're on hand right now, and we'll be right back.